The Digital Health Voice podcast is brought to you by MedTech World in collaboration with Digital Health Malta. All the twos, 22. Something like some Maltese tombola here, where we have all this excitement going on. And I can't believe that we are at episode number 22. And today with us, we're going to have Anton Hasselgren, who is a researcher at the Norway University of Technology and Science. And over there, Anton is actually researching on blockchain in healthcare. Furthermore, he is also a digital health specialist at Accenture. And I think we have a lot to learn from him and to kind of absorb, especially about distributed ledger technologies in healthcare. And with that in mind, we dive deep into the podcast. So welcome, Anton. It's such a pleasure to have you here today. And I'm looking forward to speak to you because you bring a bit more like this distributed ledger technologies approach to the whole, and this lens, which is very important to the whole healthcare, IT, digital health picture. But I want to be a bit more basic than that, Anton. And I want to ask you, what's your digital health journey? What brought you here with us today? How did you end up on a digital health podcast? How did that happen?
Sure. Yeah. So first of all, thanks very much for inviting me, Stefan. It's always a pleasure to talk to you, and it's going to be fun to talk to you in this format as well. So it's a good and quite big question. How did I end up where I am today? So basically, my academic journey started with me studying more towards sports science and public health, and during this process in my bachelor, I got sort of introduced to medical technology, to digital technologies within the broad scope of health. And after my bachelor's, I continued with a master's in global health because I want to have a sort of a broader focus on the global environment and the international health landscape. And also during these studies, I saw sort of the impact that digital health and new digital technologies can do in the space of global health. So I really wanted to continue in the field of medical technology. And after my master's, I got the opportunity to continue with a PhD in medical informatics, specializing in looking into the applications of blockchain technology within the space of healthcare. So this is what I've been doing for the last 4 years as a sort of my main occupation. And I've also been involved in a couple of startups focusing on medical technology during this time, and sort of in the intersect between digital technology and global health, I would say.
Wow, that's just cool for me, from sports science and public health, going further, into blockchain, DLT, pretty cool, I have to admit. And we also had the opportunity to know each other through the European Public Health Association, so that's also really great. How we make the links in different ways, like the pathways, how even the conversations converge, at the end of the day, if there is a determination by both parties to make things happen, how great that is, But I'm really curious. I mean, you've told us about your journey, but I'd love to hear a bit more about your research and projects, and especially how you communicate these outcomes. Have you published anything yet, especially in relation to the work you've done? Have you seen this work maybe even better? Because we love the practical side, even in Digital Health Malta and MedTech, where we really love the practice. Has this translated into something like an amazing startup or an interesting project? The floor is yours.
Sure. So definitely. So during my research in my PhD project, I started on this work about 4 years ago now, and during that time, there was the field of blockchain and blockchain healthcare was very new. There was very few people who knew anything, and the publications or the peer-reviewed publications that we had back then were quite, I would say the quality was very shifting. So there was not really any good directions within the research field of blockchain in the health sector. So there was some navigation there in the start. Okay, how should we, what kind of method can we use to sort of dissect this area? What is actually needed in the research community? So I started by doing quite a large systematic review over all the peer-reviewed publications within this area. And an outcome of that research was that, as I mentioned, the quality was very shifting. But we also saw that the quality was increasing sort of year by year and even month by month. Well, this study we did about 3 years ago, and I mean a lot has happened since then. I mean, both in public health in general, of course, since we had a pandemic sense, and also within the field of medical technology, and maybe especially in blockchain and distributed ledger technology. So, I mean, now is the direction in the research is much more clear. There are clearer methods that you can use, and there's much more value to find in these peer-reviewed publications. So I have a number of publications on the subject in peer-reviewed journals. I also try to communicate the results of the research and also my sort of general opinions about this space in all kinds of formats, conferences, podcasts, and such. We also have, we are in the starting phase of forming a company with the outcomes of one of the research sort of small projects that we did. So we have a concept that we call 𝐉𝐨𝐬𝐬𝐻, which we hope it could be some kind of commercial venture quite soon. So this is also a way to sort of communicate the research results and sort of get the results to benefit the larger community.
Wow, you got me thinking there, Anton. I mean, now it's, I think really and truly, the sky is the limit now. And even like this 𝐉𝐸-𝐬𝐬𝐻, it's like making me think about healthcare professionals, verification. I don't know. I'm curious like how that will turn out. And it's also great that you got the opportunity to share your knowledge outside of academia as well. You know, like opening and branching out. And that's really and truly, because that's the beauty of academia, when there is this knowledge transfer. That makes it like even more meaningful. And I know there's a really big change sometimes when, and this happened in digital health in general in the past years, like when these are like uncharted territories. It's not like the usual, for example, cardiology research or the usual, research in any other clinical or medical specialty. There's a special kind of there's this design. But I just want you very quickly, if you can, Anton, can you just we have really a wide audience in our podcast. Can you just explain super quickly, maybe in something that we can really understand, what a systematic review is? Just like really quickly, like to have an idea.
Sure. So a systematic review is basically a way to summarize what has already been done in a research topic. So you try to summarize it in a systematic way. So so you try to minimize the bias in your summary. So you try to sort of map it out as objectively as possible. And this is a common way to sort of summarize the overall research results in a particular research topic.
Yeah, and you involve more than one person, I guess, right, in the systematic review. Did you have the opportunity to do that?
Exactly. So that's one way to reducing the biases in the overview. So you're supposed to have at least a few people that do the review of the selected publications that you're considering including in the review, and that way you're not basing your results on just sort of how one person interprets the criteria that you have set up. Because even though you have quite strict criteria on what to include and not, there's always some kind of subjectivity into how to interpret these criteria. So the more people, the more objective.
Yes, I mean, I think we can wrap our head around that. But Cool, like really. I mean, you're doing so many things, Anton. And like when I follow your LinkedIn profile or your updates, I'm always like really happy to see this developments going on, especially because sometimes blockchain, it's like related only to cryptocurrency, and it's really and truly kind of it's not just about cryptocurrency. It's about how much like value there's like this transactional element which is going on so many times in healthcare. There are so many transactions going on in healthcare that we needed a technology which can really work well. And even now, when we see the evolution of Web 3.0, we're seeing the evolution of like a different architecture of the internet even, that there is really a bigger possibility and a bigger like possibility, especially for this technology to become a more integral part of our lives, maybe even without realizing that it's there, because it's so integral that that's like another like layer of transparency. But now I'm gonna give you some opportunity for some blue sky thinking, Anton. How do you what's the future like for digital health and MedTech from your perspective, and especially the university and the organization we work with? I know that Norway is one of the leaders, especially in digital health, and even Sweden is also one of the leaders there. But how do you see it like fit in, or like how do you see the pieces of the puzzle come together? Is there a point where you say, aha, like this eureka moment for everyone?
Well, I mean, we are facing quite a large problems within the health sector, mainly due to the demographic shift in the population. So we're going to be more and more people getting older and going to have more complex chronic diseases. So we have more people to treat and take care for a longer period of time. And of course, this is a positive thing, because we live longer and we can treat more diseases and so on. But it will put enormous amount of pressure on the healthcare systems, not just in Scandinavia and Europe, but all over the whole world. And also in low resource countries, you have the same problem with the demographic shift, but you also have the sort of the old problems that still are present with malnutrition and malaria, HIV, and all these other kinds of health problems. So healthcare systems all over the planet are facing quite the pressure. And I think to manage this, we need to develop and we need to take in use new tools. And the digital tools is of course one way of handling these problems. For example, we could deal with the shortage of healthcare professionals. I mean, there's shortage pretty much everywhere in the world now, but there's a larger shortage in certain places in the world, and we could maybe overcome these shortages by telemedicine solutions. We could have AI health workers instead of sort of real health workers. So I think the telemedicine and the implementation of AI tools that could free up the time of the sort of the real healthcare professionals, that will be the sort of the big game changer, I think.
Yeah, like addressing this health workforce gap, because no matter how many humans we put at it at the end of the day, there's still going to be the gap because of this growing demographics. I mean, I fully agree with you there. That technology can really at least help fill the gap, help make the gap feel smaller, at least, especially when we're dealing with scale, especially when we're dealing with issues of access. So technology definitely has a role there. I mean, it's amazing, Anton, we're already getting closer and closer to the end of this podcast, and I mean it's incredible because I had such a pleasant conversation with you, and the pleasant conversations happen when different parts of your brain start getting activated whilst listening to that person. Say, oh, it's this, oh, it's that, and start making the connections. That's the beauty of having these wonderful conversations. But I have maybe a bit more like a chilled question. Like, we know that you were in Malta for MedTech �W𝐿 2021, and we really appreciated that you made it all the way here to our little island here. But what we want to hear from you. What was your experience like? Did you enjoy it? I know that there were some challenges at the end because we had to literally rush out of the building for safety reasons. And I believe, I'm not sure if you had a session, but we couldn't do the session. But are you gonna make up for it in MedTech �W𝐿 2022? What are your thoughts? What are your experiences, memories?
Yeah, so I really enjoyed the conference. There was a lot of good content in the conference, and there was some amazing people there that I talked to. And also visiting Malta for me the first time was it's pretty amazing place. So it was definitely a nice experience. But it's quite funny you mentioned what happened during the end of the conference. I mean, this is of course no criticism to the organizers. This is just the circumstances, but I had my speaking slot at the end of the conference, and while being on stage with some other people, suddenly the fire alarm went off, and we had to evacuate the building. So we hadn't really the opportunity to finish our roundtable discussion, but I hope we can have the opportunity to do it again next year, and yeah.
Maybe this year, yeah, in 2022 in November. I mean, I have to do it's interesting how stories turn out. But then there was, what was interesting is that it ended up being a round table discussion outside because everyone was speaking with each other, everyone was networking, and really truly that is the beauty of the conferences, because if you had to kind of just focus on the content, it can be done virtually if it's just content. But if it's real life networking and, creating meaningful conversations, then really and truly, we need to, be in touch and speak to people and be there.
Yeah, so I definitely agree with you. I actually had some of the best conversation during the conference after we evacuated the building. Then people was quite easy to approach, and the conversation was quite easy.
Yeah, I'm happy to hear that. Also, I wanted to pass a comment that your beard really suits you, Anton, because I'm really used to you seeing you without the beard. I said, "Oh, that's cool, man." But this is the cool part about the podcast, definitely. Now, we have an opportunity here. Now, we're coming at the end of the call. And you have 1 minute, Anton, to raise awareness on any topic of your choice. So there is something, it doesn't have to be healthcare related, it could be anything, but it's something you have 1 minute to raise awareness on, something which is close to your heart or something which is really meaningful. Go for it.
Okay, yeah, thanks, Stefan. So I want to take this opportunity to speak quite shortly on blockchain and what blockchain could do in healthcare. So first of all, blockchain is not cryptocurrencies, because a lot of people directly associate blockchain with cryptocurrencies. Yes, it is used in cryptocurrencies, but it could do so much else. And we have evolved in a point in technology now where we have really proven that the technology is working and is solid. And we do have good use cases in the healthcare sector where this technology could really make a difference. For example, we could put vaccination certificates on a blockchain or distributed ledger. We could put verifications of competence and skills of healthcare professionals. Or we can put the ownership of your medical records. We can direct that to the patient, so the patient feel and have the ownership of their health data. That could empower patients, and that could ultimately make patients more aware of their own health and health status. I think that will be very important in the future to come, to give sort of more power to the patients and to empower patients with every tools that we have available.
Lovely. Wow, that was spot on 1 minute there. And with that in mind, I would like to thank you, Anton. I would also like to thank our audience and remind you that you can follow the podcast on all different podcast channels. We're available on Anchor, Spotify, Apple, iTunes, Google Podcasts. You can really find us anywhere. And also, you can even follow the video version of these podcasts, which is available on Facebook, YouTube, LinkedIn, and even some hints of it also on Twitter. And thank you for that. Don't forget to rate us as well. Give us ideally give us a 5-star. It would be really appreciated, But let's say we'd love to hear your feedback. And with that in mind, I wish you saha.